tell you when. We are live.
Yay!
Facebook family and friends, how are you this evening? I am back again for another special edition weight loss expert series, and we're talking today about the gut. So I'm Dr. Janine. I'm your board certified family doctor and weight loss specialist. I help women get their sexy back by providing a comprehensive medical weight loss program. I'm also the operator and owner of Lifestyle Changes, which is a virtual medical practice here in Pennsylvania. And I have a special guest here with me today. So this is Dr. Firlande. She's going to introduce herself. Thank you so much for coming on today. She's my super friend and fellow weight loss expert, and she knows all about the gut. So let's introduce yourself, Dr. Firlande.
Absolutely. Thank you, Dr. Janine, for having me. I'm excited today to be talking about this. So I'm Dr. Firlande. You have a little echo. Do you hear it?
Not on my end.
Not on your end? Okay.
Yeah.
Hopefully it's good, but I can just hear myself a little bit.
Okay.
So I am Dr. Firlande. I'm a naturopathic physician. I'm also a best-selling author, speaker, and weight loss expert. So I offer natural solutions to women who are between 20 and 50 pounds overweight so they can have the courage and confidence to love themselves and their lives while they are managing the weight.
Yes, absolutely. All right. So let me see. There's someone on, but say hello so we can acknowledge you.
Yes, absolutely.
Yes. Yeah. And then we're going to dive in to learn about the gut and weight loss, how it's applicable to each other, because it's very important. All right. So when you join, please tell us hi so we can acknowledge you. And then for those that watch us later, just play some hashtag replay as well.
Mm-hmm.
Right. So, Dr. Firlande, what in the world is gut health?
Yes.
So important to weight loss.
Oh my God. So gut health is super, super, super important to weight loss. So I'm going to define gut health a little bit. When we think about gut health, we can imply that if you have healthy gut, you don't have a lot of major symptoms like, a bunch of gas and bloating, diarrhea, constipation, all just alternating between the two of them. You have a healthy balance of microbiomes. So there's going to be like your bacteria. You do have a little bit of candida in your gut as well, not a whole lot. You also have, yeast, and that's part of the candida. You also have parasites, because some people do have the parasite in the gut as well. So but it has to be a healthy balance, because if it's not balanced, if one type takes over the other, then that's when you get imbalance in your gut microbiome. But also, when we define gut health, you have to have at least 1 to 3 bowel movements per day. If you have like 0 bowel movement, or you have like, some people can go on months without having a bowel movement, that's not good gut health. That means,
tell me how many times do you have to go in a day?
1 to 3 times.
Girl, really?
If you think about children, like babies,
yes,
1 meal in, 1 meal out.
Yeah, well, I need help with my gut health then, because we skip some days.
Oh, yes. A healthy gut, really, after you eat, within like, 2 to 3 hours, you should have bowel movement. So now you don't have to have 3 bowel movements, but you have to have at least 1 bowel movement a day, especially if you're having like 3 meals a day, right? So anything that stays in your gut for too long is gonna cause toxicity, or you have a lot of toxin buildup, but also is gonna cause like skin issues and so on and so forth, which we're not gonna go into right now. But the main thing is that making sure you're having a bowel movement at least once a day.
Okay, we are live. All right. Okay. All righty. I need help. So there's a question that just came through. So let me share that with you.
Oh yeah.
So our
Prebiotics.
this is helpful as probiotics.
And we will go over that a little bit. So prebiotics, they basically help your probiotics. So the prebiotics are the things that you're gonna take, like FOS, which is fructoaminosaccharides. That's gonna help, especially if you're taking probiotics, right? It's the food for the bacteria. Okay, so it's very important, especially if you don't have good gut health, to make sure that you do take some prebiotics.
Okay. All right.
Hi, Anisha. BB in the house.
Okay. So, all right. So I think you started talking about how it is important for weight management. Can you go a little bit deeper with
Absolutely. Okay.
Very important with maintaining your weight and losing the weight and everything.
Absolutely. So the way I look at gut health, so if you have gut issues, it goes to weight gain a lot of times, right? So many people have either they have when you look at them, if they have colitis, if they have Crohn's, if they have diverticulitis, or they can have an array of different gut issues. But if those things are not taken care of, they can cause long-term problems, right? So you're not assimilating your food properly. So if you start having food sensitivities, right? Food sensitivity is equal to water gain, right? So all of a sudden you feel bloated all the time and you're not losing weight, okay? Also, the second thing is that if you have food sensitivities, you may start having thyroid issues, right? Because some of the protein from that thyroid, your thyroid protein, sometimes the body mistake it for being a foreign matter, like an antigen, and the body start attacking it. So all of a sudden you have Hashimoto's, low thyroid issue, you're getting weight, not able to lose the weight, and you fatigue all the time. Okay.
Right.
Also, this is like the cascading event where, because most of your serotonin is found in your gut, right? Is actually made in your gut. If you have unhealthy gut, all of a sudden you have anxiety or depression. With anxiety and depression, guess what? You go into your emotional eating disorder, which also leads to weight gain. So it's so important to make sure that you are having good bowel movement. That's one. And two is that you have the proper elements in your gut to make sure that your food is being assimilated properly and you are moving your bowel daily.
Right. Oh, that's awesome. That's
awesome.
Yes. Yes.
And I forgot to mention one more thing, which is the yeast or candida. So if you have, what happens is if you have a lot of yeast or candida in your gut, which can take over, you're going to have a lot more sugar cravings.
That's a good one. That's a good one. Okay.
Yeah. Sugar cravings will lead also to weight gain because now you're eating a lot more sugar. Your body is actually stored as fat and you're gaining more weight.
Right. Exactly. Yeah. Exactly. So we have a few more people joining, saying hello.
Hi, Lori.
Okay, she's inviting a whole slew of people.
Thank you, Anisha, for inviting the tribe.
And then Lisa. Okay.
Oh, yes. She said that is a problem. Yes, that is a major issue.
Right. So, since you were talking about candida, yeast being in the gut, how do we measure, or evaluate our gut health? Because for me, I don't know how much yeast is in my gut, or that may be a problem. That's why I don't go to the bathroom every day. So, or measuring the serotonin. How do you go about evaluating a client or a patient's gut health?
Okay. Yes, absolutely. So the first thing is, of course, is you're sitting with the patient and finding out how many bowel movements that they have per day, right? So if you're like, oh, I go every other day or every 2 days, every 4 days. So I have people go once a month, which is the peristaltic system is not working at all, right? That's one evaluation. So if they tell you right there and then that, hey, I don't use the restroom, that's a major way that you're like, okay, there's a problem. If they complain of fatigue, fibromyalgia, a lot of fibromyalgia is actually linked to the gut. If they also have a lot of skin issues, then, just like that physical, when you look at them physically, you're like, okay, there is something wrong with your gut. But we do like a lot of like assessment. We have at the, at most of the specialty tests that we run a stool analysis. So the stool analysis will let us know if the patient has like yeast, if they have a lot of parasites, if they have small intestinal bacterial overgrowth, and what type of bacteria they also have in their gut. Because depending on the type of bacteria, that can also determine, what specific issues they may suffer with. Okay. The other one is too, like with the stool analysis, it tells us the gut health. So you have your secretory IgA levels. We also check for that. So if it's like too high, it may be elevated. If it's you may have inflammation. If it's too low, that means something is causing your body is like, has been working so hard for so long, it kind of shuts down that process. So if your secretory IgA is suppressed or super low, that means that you can have foreign matter, you can have other things come into your gut, and the body is not able to get rid of it. Okay. And also we look at the how much inflammation is in the gut. We look at your pancreatic output. So is your amylase, your lipase, your protease, all those enzymes working to break down your food? Because if they're not working to break down your food, it can also cause the weight gain. Okay?
Right. So are all these testing, is it covered by insurance, or is this by cash, or how are patients able to get this?
So in licensed states, like where naturopathic doctors are licensed, those specialty tests are covered. So you can actually get your stool analysis done and everything is covered. Okay. So most of the time, at least 80% of it is covered. Now, in unlicensed states where we cannot bill insurance, then it wouldn't be covered. Then you have to pay out of pocket. Usually a test like that will run between like $250 and $500, which is not that bad, especially because it gives you such a comprehensive look into your gut. It's actually a great investment into your health. And I recommend it. Like most of my patients who like, I don't use the bathroom or I can't sleep at night, I have insomnia, I'm like, okay, we're going to do a stool analysis.
That's right.
Yeah. Okay. And I have one more test that I wanted to mention, which is the food sensitivity panel. Okay. It's very important that you determine if you have some food sensitivity, especially if you're not able to lose weight. No matter what you do, it's like, I can't lose the weight. So there are certain foods that you're eating that may be causing a dysbiosis in your gut, which means that you're not able to process your food properly, and then you're gaining weight. So definitely checking for food sensitivities.
All right. So y'all hear that? Check your poop. Check your poop, everybody.
It's important.
That's right. And then also the food sensitivity panel. That's a good one as well. Yeah, absolutely. So we have a few people asking questions here. Are you done with that by the chance?
Oh, yes. So you definitely want to just check your gut health. What is in your gut?
Okay. So checking your stool will give you your yeast level, correct?
Yes. And also like parasites. It will tell you if you have parasites. H. pylori. Hi, Dr. Sam.
Hi, Dr. Sam. Thank you for joining us. All right. So here's another question here for you.
Do you have to request this or will a doctor run the test during annual physical? So no. Okay. So if you go to your regular primary care, most of the time they are not going to run the test. It's actually a specialty test for the specialty panel. So you're not going to find it most of the time at your annual visit. Usually it's based on your symptoms. So what symptoms are you having? If you're having too much, like a lot of gut symptoms, some doctors may suggest it, but most of the time they're not going to have that particular test at your routine physical, like your MD. They may not have it there. So that is a specialty test that most of the naturopathic doctors will run. Or functional medicine also do it as well.
But if she were to go to her primary, they can run that for her, correct?
If the physician is doing functional medicine, or if they are a naturopathic physician, those would be the physician would have those specialty panels. Otherwise, they wouldn't have it. So what they would do is they would check. They can check to see if you have blood in your stool. They can check if you have candida, but that the whole panel, they're not going to have that specialty test. No.
Okay. So you can't go to a LabCorp request type thing.
No.
Yeah. Okay. All right. Great. And let me make sure. All right. So I think there was another question. So how do you know if you have too much candida? I think you answered that with the stool test. So everybody check your poop.
Check your stool. And also some of the things that it can cause too. A lot of people will have they'll be burping a lot.
Yes.
So it's because you remember that foam, that's what it does. It causes a lot of fermentation in your stomach. So we can have all that foam and burping a lot and belching. Those things can be signs and symptoms that you do have candida.
Yeah. And then the other corporate is Helicobacter pylori. H. pylori. Yes.
Absolutely.
That's a big one as well. So, okay, great. That's awesome. And then what type of diet would you, after you've evaluated and such, what type of diet would you recommend your patients to maintain their good gut health after, balancing everything out? What do you recommend?
Yeah, so when that first question that we got about the probiotics, right? So you want to be having a lot of fiber-rich foods, right? So things that are high in fiber. The fiber is going to actually feed the good bacteria, okay? So you can do a prebiotic where you actually purchase the prebiotic, which is like oligosaccharides. But also what you can do is you can increase your high fiber intake. So food like artichokes are great, celery, your kale, things that are super, super fibrous, okay? It's going to help to feed the bacteria, okay? The second thing is that once you have your prebiotic from those food, you want to make sure that you have good food combination. That's something that people don't think about a whole lot, but the way you combine your food can also have an effect on how you assimilate your food. So for instance, your carbohydrate is usually digested first, right? Because it takes 2 seconds. Your body breaks it down into sugar and then it's digested, as compared to your fat and your protein. Yeah, when you eat something that's fatty, the body say, hey, stop digestion of everything else. I need to digest this fat, right? So that carbohydrate can be staying in your stomach and getting putrefied, fermented inside your stomach as well, which can cause more of the weight gain and more issues with digestion, okay? So make sure you combine your food properly. And of course, you have to have a healthy diet, okay? And, when we say healthy diet, people are like, what do you mean by healthy diet, right?
Because everybody has their own definition of that.
Right, exactly. So not all diets are created equal.
That's correct.
So I think one of the main things is that you have to have a balanced diet. You have to make sure you have lean protein. You have to make sure you have good fats. So good fats would be like your olive oil, avocado oil. Make sure you have those in your diet, because avocado and those oils are really, really good for the gut, okay? Especially if you have dry skin and you do everything else for your dry skin. And you're like, why can't I stop this dry skin? Because your gut is dry. So make sure you have good oils. And then you want to be eating foods that are above ground. So especially now this summer, you don't really want to be eating potatoes and a bunch of rice and things like that. So you want to be eating your leafy green vegetables, anything that's above ground. You can have plenty of those, and then decrease the amount of below ground vegetables that you eat. Okay, so having that balance with your meal is going to definitely help your gut health. The other thing that we haven't talked about is so I'm going to say one more thing that we need to add, and I'm going to talk about the avoidance ones, right? Things that we need to avoid.
Yes, that's right.
Yeah.
That's right.
So you definitely want to do some fermented foods, right? So do you do any fermented food, Dr. Janine?
Probably not. Like you're talking about kimchi.
Yes.
I don't like it. I don't like it.
Oh my God! Last summer we made kimchi, which is so good. Okay.
Yeah, I don't like it. I tried it. I don't like it.
So yes, you want to be having a lot of that fermented foods, right? So that's your kimchi, your sauerkraut. Do you like sauerkraut? That's good. No.
Still in my family of kimchi. No.
How about yogurt? Yogurt is really good.
Yeah, yogurt's good. Yeah, that's No. I tried it. I gave it a good try, but it's not.
Kombucha. No. So you're the type who needs a lot of those prebiotics, pretty much.
I probably do.
Yeah.
I'll take something by mouth, but those things to eat, no. Yeah,
definitely. I get it. Okay, so you do want to have those fermented foods because they're going to help to actually help your gut bacteria and normalize your gut flora. And then, of course, you do want to be avoiding certain foods. So you do want to be avoiding a lot of processed foods, right? So a lot of studies have actually shown how processed foods actually change. It does. They change the gut flora.
Everything. Everything.
Yeah. And this guy did this like experiment where all he did was like eat a bunch of processed foods. So they measured his gut flora before and after, and they noticed like how much the gut flora actually changed after he was on like a processed food diet, and he gained a bunch of weight, of course, because that plays such a great role in whether you are gaining weight or losing weight. Okay. You want to be avoiding a lot of sugar. Sugar is one of the things that also cause your gut microbiome to change, right? So you're gonna replace a lot of it with yeast if you eat a bunch of sugar. So you do want to monitor how much sugar you eating. Alcohol also is actually pretty bad in changing your gut flora. But if you want to stay skinny, just get the poop from like a person who's super skinny and put it inside of you. Then boom.
Is that right, Dr. Firlande?
That's real talk. Real talk.
I only do it for certain things. Yeah, like put poop, good poop. I understand that. Yeah.
So, I mean, there actually a lot of labs. We started doing at the clinic. I was supposed to head that project, and I never did it. But what we're doing, we're going to analyze people who are super skinny and super healthy. We're going to analyze their stool, and then we were going to do stool implant. So it's basically implanting the stool from a healthy adult who's has been like able to lose weight or is like skinny, their whole life, and implant someone who has not been able to lose weight. And a lot of research have actually shown all of this has a major, like you gaining weight, you're not able to lose weight. A lot of it has to do with your gut microbiome. So if you're able to change your gut microbiome, you're going to be able to lose weight more readily.
Right. Absolutely. There's a lot of questions coming in here. I would say this is going to be a good one. At the beginning, I told Dr. Firlande, I am here for all of it because yeah. So this is great. So pop up some of the questions here so you can see it.
Okay. So how do you quench that sugar craving due to the increased yeast in your gut. All right, so the first thing is hydration. So how much are you staying hydrated? Okay, that's number one. So you have to stay hydrated. So the more, because a lot of times that it's not because we are craving the sugar, one, because we do have candida, but also because we could be hungry, right? So first, you have to drink a lot of water, okay? The second thing is that you have to detox from sugar for at least 5 to 7 days, okay? And so when you detox from sugar, you are actually killing the yeast, okay? And also there's the candida diet. So the candida diet is where you remove all those things that are high in sugar, like your even fruit sugars. Remove all those things, and then you're able to actually normalize your gut flora, and then you don't crave as much, and then you kill the yeast that way. Of course, there are other products that you can take, like, berberine in the berberine family. That's also gonna help you kill the candida. But mainly, you need to detox from sugar for 5 to 7 days, and after that, you don't crave it anymore.
All right, great.
Hi, Cassandra.
Yes. No kimchi and sauerkraut. High five, Lori. High five.
Good stuff, man. Good stuff.
Yeah, so she said yogurt you can do.
I love yogurt.
Yeah.
Yes, Greek yogurt is really good.
Yeah, Greek. And make sure with your yogurt, you're not like buying the ones that already have the fruit in it because of the sugar. So add your fruit to your yogurt.
Right. Absolutely. Okay. Absolutely. Because you have to look at the sugar content in the back. You have to.
Mm-hmm. Yeah.
Hi,
Dr. Lakeisha. Hi. All right. I think she was saying, "Oh my word," to something. probably the stool. Yeah. The stool transplant. Yes. All right, Miss Carolyn. Hi, Miss Carolyn from Texas. Okay. All right. 5 to 7 days to detox some sugar. Yes. All right. And then I have another question here on the watch. What about cheese?
Cheese?
Yeah.
Okay.
Cara, she's saying, I heard bad things about cheese. What's the word on that?
Okay, so cheese, a lot of people without knowing it can be lactose intolerant. So they're not able to break down the lactose, which is a sugar that is in the milk products, right? So what happens is that, when you have any type, like I mentioned before, any type of food intolerances, you are disturbing your gut flora. So it's best to remove it. The first thing I would do, though, is like analyzing, how do you feel after you eat cheese? Are you bloated, right?
Yeah.
If I eat cheese or any dairy product, when I wake up in the morning, I'm all congested. So I already know that I have an issue with sugar, okay? The second thing is that you have to see if you have other symptoms, like do you have diarrhea, do you have pain, those things. There are 5 foods that are super hyperallergenic, or most people react to them, right? So there's going to be your dairy, your wheat, your corn, your soy, and of course your eggs. So the best thing that I tell people is to like eliminate those foods for like 2 weeks, and then reintroduce those food back into the diet. So when you reintroduce that particular food, if you start having symptoms immediately, you should not be eating that food. But if you don't have any symptoms within 24 to 48 hours, that food may be okay for you to eat.
Right. Yeah. So it's a trial and error, basically.
Yes, absolutely.
Yes, absolutely. All right. We have a few more questions coming through here.
Okay. So does gut flora health have a bearing on IBS? Oh my God, yes. Are there natural means to assist with IBS? Oh my God, yes. Okay.
Yes. OMG.
Yes. So, irritable bowel syndrome, that's one of those disease of the gut that has been linked to food sensitivities. So I don't call them allergic reactions. Because allergic, you have immediate reactions, right? So those are sensitivities that, people have, like intolerances. So a lot of it has to do with some foods that are eating that's actually irritating the lining of your gut, right? And you haven't gotten help anywhere else. The best thing again to do is to do that stool analysis to figure out what you have, and then follow that with like a food sensitivity panel. Because once you remove those foods that are irritating your gut, you're gonna find that all your symptoms are gone. And that's no joke, because I've worked with so many patients who were going through that. And the minute that we remove those foods, they're like, oh my God, I am 100% better.
Right, right.
Okay.
That's awesome. That's awesome. Yep. All right. So great point. All right.
You're free to you'll get, yes.
Yeah. So I have another question here on the watch party by Rose Dennis. Can you have good gut health without eating kimchi and your fermented food?
Yes, you can. I mean, like, okay, so are you taking in probiotics? Have you ever had? So the main way that you are able to analyze whether you have good gut health is, based off of some of the things that I said before. So if you don't have really any symptoms, if you still go into the bathroom normally, you don't have alternating diarrhea and constipation, and you don't have pain, a bunch of gas and bloating, you don't have heartburn, you don't have rectal pain or itching. So those are all symptoms and signs of like you having a good gut health. But a lot of times, if you are overweight, most of the time you do have some gut health, gut issues, okay? Some gut health issues. So you do have some issues that you need to tend to, because of the fact that whatever you're eating can also be irritating your stomach, but your body's so used to it that you don't even pay attention to the symptoms.
That's right. That's right. Absolutely. Absolutely. So Cassandra's telling you, thank you.
Oh, you're welcome, Cassandra. Thanks for joining.
Yes. Okay. This is awesome. We are all learning a lot from Dr. Firlande. All right. So what do we have so far? Check your poop, check your food sensitivities. There's a few foods that you should eat. And there's a few foods that you should avoid. Yeah. So we're getting some good nuggets here. This is
and and sometimes like it's supplementing. Sometimes like you are so far out that doesn't matter what you take in. One you have to remove first, and then you're gonna have to take in the good stuff via supplementation. So you may have to take a capsule a day to help you digest your food. You may have to take some probiotics. You may have to take some prebiotics. So it's all about how you go about removing those things that you're sensitive to, and then adding the stuff that you need.
That's right. Absolutely. So supplementation is good as well.
Yes, absolutely.
For the non-fermented people.
Right. But that's what we cannot do.
So yes. Great. Yeah. So any other questions for Dr. Firlande? I think we've held her on for long enough, right? Great stuff. Great stuff.
Yes, absolutely. Yeah, it was fun. It was very happy to do this.
Yeah.
Thank you, Lori. You're welcome.
Yeah. All right. Oh, you're welcome. Yeah, it's been great. Yeah. So we'll probably have to do this more often.
Right?
Yeah, because there's many weight loss experts and we have a lot to say.
Absolutely.
Yeah, we want you to stay not slim, but definitely have a healthy weight. And know what you're putting in your body, because that's number one. I know yesterday in talking to Dr. Vanessa, some people were asking, but I exercise so I can no.
Yeah.
No. It's what you're eating. It's very important. So, yeah, absolutely. You are welcome, Lisa.
You're welcome.
Yes, yes. Any other questions? All right, we'll wait for a second. So while we're waiting for any other questions, Dr. Firlande, tell us how we can get in touch with you. So Dr. Firlande is based out of Georgia, uh,
Mhm.
but we can still, she can still talk to you.
Yeah, absolutely. So definitely you could follow me on all social media platforms at Dr. Firlande. That's DrFirlande. So I'm available on all my platforms there. You can definitely book like if you just have questions. I do like a free consultation. With most people, if just they have questions or they're not sure which direction to go. And also like that she has, I have the 10 secrets to lose 10 pounds in 10 days. Okay, so,
Once
so again, it's not another fad dieting. So if you apply those 10 secrets, actually, you're gonna have long-term weight loss. Okay, so it's secrets to lose. She has it right there. If you go to www.secretstolose.com, you can grab my 10 secrets to lose 10 pounds in 10 days.
Yes, so those quarantine pounds.
Exactly. Right?
That's right. That's right. Well, thank you so much
Yeah,
for
thanks for having me.
joining. Let me make sure there's no other comments here. All right. So Dr. Lakeisha saying some good information. Yes, this was great.
Yes, thank you,
Yeah.
Dr. Lakeisha.
And Lisa said, I need those 10
Secret. Absolutely. Go.
Yes.
And you should post, like, if you follow each one of them, like, you should definitely post like your weight loss
Yes.
success.
Yes. And Lisa, you are welcome, Dr.
You're welcome.
Yes. And then on the watch party, there's a lot of thank yous here as well. And one person wants to know if you're local. She's actually in Georgia, but
I'm in Georgia.
yeah. So
But you know what? Everything is virtual. So we can do everything virtual. I can send you your stool kit to
right.
your
That's right. That is correct. That's correct. Yes. So any other questions? All right. Well, thank you all for joining us this evening. This is our second day with the Weight Loss Expert Series. Tomorrow, I will be back by myself. I'm kind of sad. But I'll be back tomorrow by myself. We'll be talking about postpartum weight loss. So losing the mommy weight. Yes, yes. So I know for both of us, we know about that, right?
Absolutely.
Yes, yes. So I'll be back tomorrow to discuss that. And yeah, if there's no other questions, we'll be signing out. I'm Dr. Janine, your board certified family doctor and weight loss specialist. I help women get their sexy back by providing a comprehensive medical weight loss program. All right. So thank you all again for joining. And we're all done for the night. Thank you, Dr. Firlande, so much for sharing all the knowledge and the nuggets and the just everything. So
Thanks for having me. It was such a pleasure to be on the panel.
yes, thank you for being here. All right. So have a good night, everybody. Bye-bye.